Well, hello, everyone. Good morning, good afternoon, good evening, depending on where in the world you may be joining us from. My name is Ron Hoppy. I'm the CEO of WorldWide HealthStaff Solutions, and it really is a great pleasure for me to be able to welcome each and every one of you to this really important webinar this morning that I think you will find to be extremely informative. We are joined today by representatives from BAYADA Home Healthcare, and in our presentation today, we will be exploring what home healthcare is here in the United States. The term, I know from my travels, has different meanings in different parts of the world, and we're excited to have some of the experts this morning share with you about great career opportunities that you may not even be aware of, opportunities to practice acute care nursing in the way that you always imagined you would be able to. I know from speaking with nurses all over the world regularly, the challenges of caring for 7, 8, 10, 12 patients at a time does become overwhelming at times. And what you're going to hear today represents a great opportunity with an alternative approach to practicing the type of nursing care that you envision being able to provide when you first went into nursing school or when you first graduated from nursing school. Just a couple of really quick housekeeping items. I see that many of you are already participating in the chat. Two things. One, I'd ask each of you to just take a moment and type into the chat where it is that you're joining us from in the world. We're always very interested to see where our attendees are from and how many different countries are represented. Secondly, we want to answer your questions. And again, please use the chat feature for that. We have a member of our team, CJ, who is on, and he's going to be monitoring the questions. We're going to set aside dedicated time at the end of the presentation to answer as many of your questions as we can. So please just be sure to get your questions into the chat, and we'll certainly do our best to respond. Lastly, before we get to formal introductions, please know that if you are attending this webinar session today live, you will also receive a video recording of this by email within the next 24 hours, probably around this same time tomorrow. And so you'll have the opportunity of reviewing the presentation if there's any information you want to refresh. And also, please feel free to share that link with any of your nursing friends and colleagues that you think may be interested as well. So with that little bit of background, it's my pleasure this morning to introduce Joanna Horst. Joanna is a division director with BAYADA, and she is also responsible for clinical innovation, leadership, and support. Jessie Trudell is a project manager with BAYADA, and she is our primary contact as we partner with BAYADA to help them build their workforce through international recruiting. And then we're very excited to have Charley Sabelo join us this morning. Charley, a few years ago, was just like you. She was a candidate looking for an opportunity to pursue her American dream. And we're very grateful to Charley to have joined us today to share a little bit of her story that hopefully will inspire each of you. So with that, it's my great pleasure to turn it over to Jessie. And Jessie will take us forward through the next section of our presentation today.
Thanks so much, Ron. Great to have you here with us today. So I just wanted to start with an agenda, what we're going to be covering today. We're going to jump right in and start with what is home care, followed by a BAYADA overview, who BAYADA is as a company, what we do, followed by some role opportunities, which Joanna will present. We have a home health nurse opportunity and a SNU nursing opportunity. Then we'll hear from our BAYADA nurses, including Charley, followed by walking through our locations that we're hiring for in the US, what we provide as part of our global nurse employment package, and then we'll end with a Q&A session. So jumping right into what is home care. As Ron had mentioned previously, there are many different perceptions around the world of what home care is and what it isn't. So we would like to explain today and stress that it is critical care in the home. It's not just companion care, but it's nursing care in its entirety. Our nurses go out and work with clients one-on-one. They have flexibility in their schedules, but it is a little different from a nurse working in a hospital in that you do have that one-on-one care. When a nurse is in the home of a client, that is the only client that they're focused on. So now we would like to watch the What is Home Care video to learn a little bit more.
When I was in nursing school, didn't really hear much about home care. The best thing is just to tell people.
Home care is nursing in its entirety.
The holistic care that you get to provide in home care was what I knew nursing to be.
In a hospital, you have 5 different people that you have to call to manage different things with your patient. In home care, I learn all that stuff.
The only things that I heard was that it was not very skill intensive, that your skill sets are going to get rusty. False. I've learned new skill sets. I get continuing education through BAYADA all the time.
I know how to work the ventilator. I know how to take care of the trach. I know how to crack an oxygen tank. I know how to work an ambu bag. I can take care of you.
Our care is so detailed that it's phenomenal. And that's the kind of stuff that people don't hear when they're in school. They're you're going to go and you're going to be, like a glorified babysitter? No, couldn't be further from the truth.
Home care is a collaborative team approach to nursing, which I didn't know until I did it. This is why you became a nurse. You became a nurse to treat the whole system, the patient, the family, the illness, the doctors. You touch every aspect. A nurse in home care is like the hub of a wheel, and you're in touch with every spoke of that wheel. And you have a chance in home care to make an enormous difference with a patient and a family and the other nurses. It's everything all wrapped up into one.
Okay, so the What is Home Care video does a great job at explaining that it is nursing care in its entirety. As I mentioned, it is that one-on-one care, but as the video shared, it's a team approach as well. You're working with the patient's doctors, you're working with the patient themselves, you're working with the patient's family. So it's that one-on-one care, but you're supported as well. You have a team behind you, you have support clinically, and really it is a true team approach. Now I'd like to just give a little bit of a BAYADA overview, who we are as a company and what we do. So BAYADA was founded in 1975 by Mark BAYADA, and you can see Mark in the picture on the right. He is the man on the right, shaking hands with our now CEO, David BAYADA, his son. So over the past almost 50 years, BAYADA has really become a trusted leader, providing full range of clinical support both to adults and children of all ages. We currently employ over 24,000 caregivers, including nurses, therapists, other home health professionals like home health aides. And actually, I believe 11,000 of those 24,000 are nurses. We currently have over 370 field offices in 25 states with locations in 7 different countries. And then a key point I want to share is that in 2018, BAYADA actually made the transition from a for-profit company to a nonprofit organization. Mark BAYADA made this decision to ensure that we can to ensure our longevity as a company, to make sure that we can offer care for many years to come. And in fact, in 2019, BAYADA served its 1 millionth client. We also are getting we are voted best employer, best healthcare places to work by organizations such as Glassdoor and Forbes, specifically best employer for women by Forbes. So that's something we're very proud to share. Now I'd like to hand it over to Joanna to speak on the BAYADA Way.
Thank you. And good morning, everyone. The BAYADA Way really is the core of the why we do what we do every day. And we talk about it, we live it, and we try to show it in every one of our actions. So the BAYADA Way reads, expresses what is most important about the work that we do, the way we should work in the spirit and in action. Quite simply, the BAYADA Way is what keeps us together and yet sets us apart as the best of the best. Our mission is to help people have a safe home life with comfort, independence, and dignity. And our vision at BAYADA Home Healthcare, we will make it possible for millions of people worldwide to experience a better quality of life in the comfort of their own homes. And our values, which we talk about again and again, are compassion, excellence, and reliability. 89% of our employees say that they're proud to work for BAYADA. That's remarkable in this day and age. And I can tell you personally, I've been with BAYADA about 3.5 years. I am so proud to work for this organization. Next slide.
Thanks, Joanna.
There we go. Two role opportunities that we wanted to share with you today. We have our home health nursing opportunities. Our home health nurses generally visit 5 to 6 clients each day and spend 30 to 60 minutes with each of their clients, providing very skilled care within the home. The clients are homebound. They need intermittent care, for example, wound care, IV medication. And it provides you as the nurse the opportunity to connect with multiple patients who need a variety of care, but you're connecting with that patient one-on-one. It's amazing. You don't have call lights going on. You don't have other things happening. It allows you as a clinician to focus on one patient at a time. And then we also have opportunities in our skilled nursing or SNU nursing section. And that is 1 client per day where you work an 8 to 12 hour shift. A lot of the patients represented in the video that you just saw were in our SNU section. The clients have complex medical needs and require ongoing care. For example, clients may need tracheostomy care, ventilation care, respiratory treatments. And it really also provides the opportunity to connect with a few patients regularly, so you know your patients so well.
Thanks, Joanna.
You're welcome, Jessie.
And on today's webinar, we wanted to make sure that we gave you all an opportunity to hear from a nurse in each of those practices, both home health, the home health nursing role and the SNU nursing role. So Ray is not on the webinar with us today, but Ray is a registered nurse who was recruited from the Philippines and joined BAYADA in 2014, actually. So he has been with BAYADA for 8 years now. And actually just last year, Ray won our RN National Hero of the Year Award, which is a program. The Hero of the Year Award is a program at BAYADA that selects one RN each year out of those 11,000 nurses that I mentioned, who really exemplifies the BAYADA Way, who goes above and beyond in caring one-on-one for their clients, and who really just embodies BAYADA as a whole and puts the client first. So let's meet Ray and watch his hero video.
It was BAYADA who brought me here in the United States with my family in tow and only $300 in my pocket.
He's put his life work into working here at BAYADA and then being able to fulfill his dreams of becoming a U.S. citizen. He's looked at by so many with such a big heart.
Ray is your nurse that you want to come out and take care of you.
Ray is a genuine nurse. He shows his compassion through his work, because every time I go to follow up with a client that we co-treat together, they can't stop saying how excellent care they received from him and that they hope he comes back to see him again.
He is a guru at wound care. He has very complex clients, including the Sullivans, who he's been taking care of for a really long time with a very complex wound.
If I could define Ray in one word, it would be the client, the client, the client. He is very, very concerned about the client.
My husband was in and out of the hospital most of 2020. And there were several times when Ray just called me and asked, how is Charles doing? So he takes that personal interest in his patients.
Ray is honestly one of the most reliable nurses I've ever met.
Ray is always there and always, always with a smile.
Ray comes in with a big hello, tells a clean joke or a clean story. Often he is the butt of that joke or story.
Ray is one of those really special nurses that I've seen patients remember a long time after he's gone. You see that he really builds those special bonds in a short time frame.
I was surprised to be named like Hero of the Year. I'm just saying to myself that I'm just doing the same thing, every time. My wife is so excited. She told my parents in the Philippines that I won the award. That's a really big deal for them. They were proud.
Congratulations gali, indaog ka sa National Hero Award under sa BAYADA Home Health Care. Congratulations. Stay safe. Along ka muna. God bless.
I'm so glad that BAYADA was able to help me, pursue my dream. Come to the United States, be a nurse.
I had 700 people when I worked under me, either direct or indirect, reporting to me. And I can honestly say that Ray would be at the top of the list if I was still employed and he worked for me. BAYADA is very, very fortunate to have employees such as Ray.
So Ray really does an outstanding job at representing what a home health nurse is at BAYADA. So Ray is, as Joanna mentioned, he's in the two roles. He falls in the home health category. So Ray is doing those 5 to 6 client visits a day for about 30 minutes each, and he is making those one-on-one connections, as you saw in the video with the Sullivan family. He's making those one-on-one client connections. And then I think we're just waiting for the slide to come back. Thank you. And now I would like to introduce Charley Sabelo. She recently joined BAYADA in 2022 as the first nurse to participate in BAYADA's new global nurse program. So with that, I will hand it over to Charley to share a little bit about her story.
Good morning, everyone, and good afternoon, wherever you are. Okay, well, first question is why I was looking for international nursing opportunities. To tell a little bit of my career background, I had been working as a nurse in the Middle East for a total of 10 years. I was in Qatar for 2 years, and I was in Dubai for 7 years. So I always believe in the saying that there's no growth in the comfort zone. But don't get me wrong, because I always love to be a nurse, especially being home health care, and I'm very passionate about it. But I told to myself like I want a new opportunity, and that is to explore other country, and that is here in the US. So I plan to took the NCLEX, and I challenged myself because I'm telling you it's really hard. So I work hard on it. I focus on my review, and thank God I passed on my first try. And here I am, here in the US now. And the second question is, what drew me in here in BAYADA? Honestly, I really don't know anything about BAYADA, but after I passed NCLEX on 2019, one of my friends recommended WorldWide Health Solution. So I sent message to Sir Ron right away, and he immediately replied, and he told me to send my CV, and there you go. That was the start of my application. They set my interview to BAYADA, and of course, before having an interview with them, I researched about the company profile about BAYADA, and I found out that they are a big home healthcare organization with many branches all around the world, all around the state, I'm sorry, and even to other country. So I didn't have that second thought of getting an interview with them. And well, honestly, I can say that I didn't regret joining BAYADA, and I am already here in US, here in New Jersey for 4 months, and I really feel that I'm part of BAYADA family because of the support from my nursing director, from my nursing supervisor, and all the staff, as well as to my colleagues. And the next question, what working in home health care is really like? Well, first of all, as what I mentioned a while back, I was a home care nurse for a total of 9 years. What I really love about working in a home health care is having that connection to the family where I work, especially to the client, and I really love to deliver my care one-on-one. I tried working in a hospital, but I can say that it's not for me because I always find myself exhausted at the end of the day. But working in a home health care, you deliver your care on your patient while having that like a family. So that's what I really love about working in a nursing care. And the second is the flexibility. One of the greatest benefits of a career in home health is having more control over your schedule. Once you have a caseload, you develop the schedule according to what works best for you and your patient. And you have a control over your work hours in days off. And the third is in a home health care, you are working independently. Typically, that means you are alone with your patient, forcing you to become resourceful when facing a challenge. Having this much autonomy in your clinical life leads to the development of your stronger skills as a nurse. And another is helping the clients in the comfort of their home. Whether caring for an elderly patient or helping someone recuperate after an injury or manage a chronic illness, you're allowing them to do it in the most comfortable setting for them. Given the choice of a care setting, most people prefer to be at home when they are all injured. As the person responsible for allowing this to happen, you will sense their appreciation and gain your personal satisfaction. And the next question, what's my favorite thing about living in the United States? Well, I'm here for 4 months, and I am already here for about 4 months here in the US. And I love the environment. It's really, I mean, comparing to my previous environment, I really love the weather here, as well as the generosity of the people, as well as the feeling of like you're welcome. When I came here for the first time, I don't know anyone here except, of course, Bayada. So I really didn't feel that I'm alone, because I felt the support, and they always ask me how like they always follow up, because of course it's not easy to what they call, to go in a place where you don't know anyone. But for me personally, I didn't feel alone, because I feel the support from the Bayada as well as from the people here. And another thing is the benefits as well. Working here will give you a lot of benefits, like the retirement fee. I believe that we don't know that. I mean, I believe in the saying that we don't really know what will happen tomorrow, but having that benefits of working here will give you a security of your future, like paying your taxes, as well as having this retirement fee that you are paying, as well as the company as well are helping you in order to have that security in the future. And the last question is a piece of advice for the incoming international nurses here. Well, I've been in that situation where I was looking for an opportunity to come here in the US. And the very first advice that I can give is make your mind, set your mindset. Coming here in the US is really overwhelming. At the same time, it's exciting, but we need to prepare ourselves in coming here, especially when you're not used to the cold weather. Yeah, so prepare yourself for that. You need to research about the weather, whether you like you need to research about all the states as well, like what I did. And also you need to prepare yourself with the experience of being a nurse. Well, coming here in the US will give you the opportunity to meet different people, but in nursing you'll have the opportunity to meet different diverse nationalities, as well as different cultures, as well as different different medical conditions. So you need to equip yourself of those kinds of health conditions, as well as researching about different kinds of cultures as well. And another thing that I give advice is just prepare yourself. But I'm telling you, you will love it here. You will love working here in the US. So that's all I can share. Thank you so much for having me here.
Thanks so much, Charley. We so appreciate you sharing your story. And we at BAYADA and your clients are so grateful to have you in New Jersey, in the US with us.
Thank you.
So as Charley was talking about our different locations, so we in the Global Nurse Program are currently recruiting for the states of Pennsylvania and New Jersey on the East Coast. So it's in these smaller states in this red box here, so East Coast of the US. Talking about life in Pennsylvania specifically, there's a population of about 13 million people, and as Charley shared, lots of seasons with different weather. So we have both warm summers in Pennsylvania, 82 degrees Fahrenheit, 28 Celsius, as well as cold winters. I actually had the opportunity a few weeks ago to spend some time in Philadelphia, in the middle of Philadelphia, Pennsylvania, in the middle of October, and it was about 65, 70 degrees Fahrenheit, which I believe is about 21 degrees Celsius. So that's perfect weather to me, but as Charlie mentioned, it might be different weather than what you're used to. So outside of the larger cities such as Pittsburgh and Philadelphia in Pennsylvania, Pennsylvania has more rural areas, rolling hills and valleys, lots of natural open space. So some of the culture is that they have many historical sites and museums in Philadelphia, lots of hiking and outdoor activities as well. And then life in New Jersey, very similar seasons to Pennsylvania because they are very, very close in vicinity to each other on the East Coast. So we've got a population of about 9 million people in New Jersey, and you kind of have the best of both worlds here because you've got the bigger cities in that top picture, but you also have the beach life as well. They have 130 miles of ocean coastline along the southern parts of the state. So you really do have the opportunity to experience time in the city as well as spend time at the beach and in those more rural, less populated areas. New Jersey is also within driving distance to many of those bigger cities that the East Coast is known for, like New York City, Philadelphia, and Baltimore. So to wrap this section up, we are hiring for locations in Pennsylvania as well as in New Jersey. If you're interested in interviewing with BAYADA for either the home health nurse role or our SNU nurse role, we do have a few interview qualifications we ask for before reaching out to interview. So we ask for a minimum of 2 years of hands-on critical care experience, acute nursing experience, as well as passing the NCLEX RN exam. We also look for really strong interpersonal good communication, as well as a willingness to relocate to the U.S. in about 15 to 18 months. That's about as long as the immigration process takes. And then when you arrive in the U.S., we do require that you get a driver's license and a car so you can drive to client homes. Because this is home care, you are based out of a central field office where other nurses and support are based out of as well. You may stop in that office for team meetings, for supplies, and then you drive out to the client's home. So we do require the driver's license and the car. And then just a little bit about what we provide as part of our global nurse employment package. So working with WorldWide, our recruiting partner, we offer expedited immigration processing and cover attorney fees. You can also have immediate family members included on your visa petition for coming to the U.S. to work. We offer, as part of the package, a green card, the sponsorship's included, and then airfare to the U.S. for the nurse once that immigration process is complete and you are ready to come over here. We also include relocation reimbursement as well as assistance in planning with your move. We understand that it can be a huge move to come across the country to a new country. So we do offer support in planning with that, as well as licensure assistance for getting your nursing license once you do land in the United States. Once you're ready to start working with BAYADA, we offer clinical training and support as part of our onboarding process. Charlie shared that it really is that one-on-one care. You have autonomy when you're working with clients, but we also want to share that you do have clinical support. You do have people you can call. There are lots of other nurses that are working in the same vicinity as you. And so we do want to emphasize that, yes, while you are practicing at the top of your license in that one-on-one patient care, you're growing your skills, you are never alone either. And there's always someone you can call to get assistance. We also have a few opportunities for career growth for our nurses. Many of our nurses grow into leadership roles such as clinical manager, which is like a nursing manager position, or office director. The office directors lead the field offices I mentioned, which is the central location where nurses come for team meetings, for supplies and support. Additionally, as our global nurse program grows and we continue to recruit internationally, we want to emphasize that you're not alone here. Our goal is to group our global nurses together so we can create communities and so that you have support. And with that, I'd like to wrap up the what is part of our offer section and move into the Q&A.
Well, thank you everyone for sharing some great information. CJ, I see there's been a number of questions coming in through the Q&A. Really is also impressed to see how many different countries we have represented here this morning, from Finland and Japan and Brunei, as well as many other more familiar countries. So great to see that. So just a reminder to everyone, please feel free to put your questions in the chat. We'll do our best to respond to them. And if you haven't yet sent us a quick note just letting us know what country you're joining from, please do that now. We'd love to know where everybody is joining us from today. So with that, CJ, have we got any questions that have come in? While we're waiting for CJ to get back online, Charley, I was really interested in hearing your story and just having you share your experience. Can you maybe just take a moment and share with the attendees today, obviously without disclosing any personal information, but just a general type of sampling of the types of patients and the types of care that you've already had the opportunity to be a part of in your time at BAYADA?
Okay. Yeah. Thank you, sir. Sir Ron. I've been working in BAYADA for 4 months, and I was exposed to 4 clients already. So I'm having a client with us, what they call this, spinal injury, and he's having a tracheostomy, as well as yeah. So basically, as a nurse, I need to to perform so many procedures like cuffing him. And for me, it's a new experience because working in Dubai, it's a whole different thing because I've been dealing with mostly of my clients in Dubai was they are in elder, what they call this, they are geriatrics, and they are having Alzheimer's disease, dementia. So I don't really have a lot of patients or clients having this kind of cases. So for me, it's quite challenging in coming here because I need to deal with these kinds of clients, which I really didn't expect. But I became so excited in performing those nursing interventions and as well as I can feel the support from my office. Like whenever there's concern, I always call them, and they always reply or receive my call and guiding me. So I love the support. I love the support in BAYADA, as well as to my colleagues.
Yeah, sorry, go ahead.
I'm sorry. Another case. What they call this? I'm sorry. I'm a little bit nervous. So, one of my clients is having ELS as well. So basically, it's just the same. It's just the same intervention, trach care, suctioning. But basically, most of my clients that I already met, more are on the tracheostomy care, the peg tube care. So I'm always excited. Every time I go to my clients, I'm excited because I know that I can help them, and my always goal is to help every client that I met here in BAYADA. So that's always my goal, is to help.
Charley, thanks for sharing that, and thanks for also just commenting briefly on just how different your work in home care as a registered nurse here in the U.S. is compared to what the experience of perhaps nurses in the Gulf region would be. A really significant difference. I see CJ is back. CJ, any questions that have come in through the chat, and maybe just let us know what those questions are and direct those to the best person to answer.
All right. Thanks, Ron. Can you hear me now?
We sure can.
Cool. Awesome. Thank you so much. So we have a lot of great questions from the chat. So first, let me just introduce myself. I am CJ, and I'm working with WorldWide HealthStaff as the Applicant Engagement Manager. So I'll be with you with the Q&A today. So we have a bunch of great questions. So without further ado, let's start with the first one. So the first question here that I can see is, will you also consider hiring a US RN with an employment gap, but willing to be employed while waiting for the processing of documents?
So we'll hand that question over to our colleagues at BAYADA. I'll just say just as to start an answer to this question, first you have to understand what this individual's immigration status is in the U.S. But I'll turn it over to BAYADA to speak to that question a little more fully.
Go ahead, Joanna.
I'm sorry, Jesse. I can just speak to, if I understood the question correctly, there was a question about if there's been an employment gap. We have at BAYADA had seen quite a few nurses who took a break these past 2 years due to the public health emergency and schools being opened and closed and opened and closed. And so we have actually partnered with an online learning system to create a RN refresher course, which enables a nurse to take these 8 hours of classes. And it gives us a very good picture of how that nurse has continued to invest in their knowledge, even while not working actively. So we know if they're ready to come and jump right back in to provide safe patient care. So we do try and support that when that occurs.
All right, awesome. Yeah, thank you so much for that answer, Joanna. All right, so let's move forward. Next question is it required for us to know driving a car since, it's a home health? And she said, are we going to be alone to visit our patients?
Yeah, I can jump in on this one. So yes, we do require that our nurses have a driver's license, get a driver's license once they come to the US, because you are doing those one-on-one patient visits in the patient's home, in the client's home. So you're driving to their home, entering their home, and then giving them the care within their home. So we do require a driver's license. But I do want to share again, even though it is one-on-one patient care, our nurses are supported. You always have a lifeline. You have a person and a team you can call for help. So you're not truly alone. There's always someone that you can reach out to for help.
Hey, let me just add to what Jesse said as well. I think it's really important. So the first thing is, in the United States, regardless of the setting that you're working in, you are sooner rather than later going to need to have a driver's license and arrange for your own transportation. The prevalence of public transportation is not as great as it is in some other parts of the world. And America is also a very, very huge country with great distances to travel between locations. So the need for a driver's license isn't just a home care issue. It's something that you want to turn your attention to if you're looking to work in the U.S. And then just secondly, I'll say quickly, WorldWide HealthStaff, we have some great partners that we work with that we will put you in touch with that can assist you in either leasing or obtaining a new vehicle, either even before you arrive or immediately or shortly after the time you arrive. So this is not something that you need to figure out entirely on your own. I know for many, owning your own automobile is a dream, and part of your American dream is that it is entirely feasible for you to have your own vehicle. So just to add that perspective as well.
Cool, awesome. Thank you so much for those answers. All right, so next question is, this is for the BAYADA team. Do you train someone interested in becoming a home nurse from scratch? If yes, how is the nursing training administered? Is it physical or is it virtual?
Joanna, can you speak to our training at BAYADA?
Sure. So we actually use several different methods at the same time. So when you join a BAYADA team, you are provided a very comprehensive onboarding with very experienced home health and home care clinicians who do that education. We have moved most of that classroom training to Zoom or this kind of format so that it enables us to bring more people together. We also utilize an online adult learning system called MedBridge, and it allows you to work through some very, very important educational programs while earning credits towards your nursing continuing education, your license for your continuing education. And then once the coursework is finished, you will be partnered with what we call a preceptor, who will go with you, work with you. They will initially show you what to do, and then they begin to turn that work over to you and watch. And once we are sure that you understand and all your competencies are checked off, you can work independently. So we take the time to invest in you to be sure that you have the education and the classwork that you need to not only care for our patients well, but document well, and stay within the guardrails of what you need to do in your U.S. licensure.
Thanks, Joanna. And to add one piece onto that, I think the question asked, do you train home health nurses from scratch? So we do look for 2 years of acute care nursing experience, but you do not have to have specifically home health nursing experience. We will train you and familiarize you with the home health nursing experience.
Thank you. All right, with that, here's the next question. So this nurse, she said, I have only 5 years of OR field experience, and can I apply even though I don't have any clinical bedside experience?
I can take that. So if you think about all the work that you've done in an operating room, the attention to detail, the attention to patient safety, I imagine that more of your skills will translate than you probably think. So absolutely. Will there be some things you may need to brush up on from your med-surg days? Sure. But there's so much that OR nurses, operating room nurses do that translates over. Absolutely.
All right, thank you. Next question is there any age limit to apply?
As far as I know, there is not. All our basic requirement is just that you are a nurse, you're an RN, you've passed the NCLEX, and that you have a minimum of 2 years of hands-on critical care experience.
All right, awesome. And this one, okay.
Jay, let me just add to that, just to add some additional perspective. So in many places around the world, employers do hire based on age. And you'll see in job postings specific age ranges that a candidate must be in. In the United States, employers are not allowed to discriminate on the basis of age. You have to, of course, be fully qualified and capable of doing the work, but there certainly is no aspect of the hiring decision that is based on your age.
All right, thank you. All right, so next one is, this question is from Romnick Gaborn. He said, I want to know about yearly vacation. How many weeks or months do you have, or is it paid?
Question about orientation, CJ, did I hear that correct?
Sorry, it's yearly vacation.
Oh, yearly vacation.
Yes.
We'll let our BAYADA friends answer that.
For home health, we accrue vacation time based on hours worked. So the more hours that you work, the more vacation time you accrue. Most people who work full-time hours accrue between 2 and 3 weeks of paid vacation per year.
And Joanna, how about statutory holidays for full-time people? Is there any additional coverage there?
Yes, we all receive, is it six or seven holidays, Jesse, as well as we recognize within our BAYADA family cultural diversities, and different people celebrate different holidays. So BAYADA also supports that and provides full-time employees with an additional, what we call floating holidays. So that would be 24 hours of floating holidays per year to celebrate a holiday that perhaps we have not, we don't typically recognize in the US, which is wonderful. It gives you the flexibility to have that day off as well.
So those are questions that we had in the chat. So for all of the viewers, if you still have, or if you're interested to work with BAYADA, I will put the link on the chat if you want to talk with our live recruiter. They are online right now. So if you're interested, send us your resume, chat with our live recruiter, and work with BAYADA. So that's from my end on the Q&A. Back to you, Ron.
CJ, thank you, and Joanne and Jesse and Charlie, thank you all for being part of this great session this morning. Again, as CJ said, we do have live recruiters standing by right now. If you'd like additional information, or if you'd like to apply, you'll see at the top of the chat, we've got, it looks like a little yellow Post-it note, and you can connect with someone from our recruiting team there in real time. So we certainly welcome your inquiries. We are, as I said at the outset, delighted and excited to be partnering with BAYADA. They really are a leader in the provision of home health services in the US. I hope you've gotten just a bit of a glimpse today into just how different home health is in the US, that it does allow you to utilize your acute nursing skills, that it does allow you to practice nursing with patients mostly on a one-to-one basis. You're not having to juggle competing demands of a large number of patients in an environment where there's chronic short staffing. Whether you're joining us from around the world, I did see a number of people from within the US joining today as well. All of your inquiries are welcome. We'll look forward to hearing from you. We'll respond quickly and help you in the best way that we can. So with that, we'll wrap up this morning. Just a reminder to be watching your email about 24 hours from now for email that'll have a recording of this presentation. Again, feel free to refer to it as often as you would like. Feel free to share it with your friends and colleagues. We here at WorldWide HealthStaff Solutions consider it a high privilege to be able to partner with applicants like you from around the world. We have the opportunity to help you make a significant difference in your life. And we know that as you arrive in the United States, you are also making a meaningful difference in the lives of the patients that you will care for, and even the family members of those that you care for, who will know and have the comfort of knowing that their loved ones are receiving great care. So thank you all for your interest. Thank you again, Joanne. Thank you, Jesse. Thank you, Charlie. Wherever you are, I wish you a pleasant rest of your day. I wish you all the best. We look forward to hearing from you, and thank you for joining us today. Bye for now.